Good morning, and thank you for joining us today. Earlier, the Health Department issued a press release detailing the latest updates to the city's response to the COVID-19 pandemic. Beginning immediately, it is strongly recommended that people wear masks while indoors in public spaces in Philadelphia. They are no longer required. Given the rapidly changing situation this week, we wanted to give the members of the press the opportunity to ask questions about today's announcement in order to help your reporting. Joining us today are Health Commissioner Dr. Shelley Bettigole and Managing Director Tumar Alexander. In order to ensure that everyone gets an opportunity to ask their questions, we ask that the media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 3 or fewer. Given that we don't have prepared remarks, we should be able to move to a second round of questions if you have more than 3. Today, we will be ending the availability promptly at 11 a.m. As always, if you have questions, please use the raise your hand function and we'll take those questions in the order they are received. First up, it looks like we have Jeff Cole. Jeff, you should be able to unmute. Go ahead.
Yes, good morning. I guess the first question I have here is, does the department have comment on the kind of yo-yo nature of this, of putting it in place and then taking it down, and how that might impact citizens, transportation, businesses when it goes this way? What's your view of that?
So this is not a temporary back and forth that we're doing. We made an announcement on April 11th that this would go into force on the 18th. What it looks like happened after that announcement on the 11th is that people actually did take heed. There's not a way that we would have seen the decrease in hospitalizations we're seeing over the course of this week, just based on enforcement starting on the 18th. So what that means is we don't feel like the mandate is necessary at this point. We're not saying, hey, we're out of the metrics, we could go back next week. We're saying we're not mandating at this point, which means we're not using that ability to kind of trigger a mandate based on the metrics we had announced in February. Does that answer your question?
It does. I guess in a more layperson's term there, I understand how you're explaining that to me, but if you're running a business or a restaurant and you're thinking, what do I do? It's up, it's back. Does it undercut the fate that folks might have in public health people as they try to grapple with this? Are you concerned just with the public's perception around this now?
I think what we've seen is Philadelphians really paying attention to public health and doing what they needed to do. And I think that's probably not just masks. From what I've heard anecdotally and from what we're seeing in the data, it seems like people also paid attention to things like, don't go to a gathering if you're sick, right? And I've heard from a lot of people that they had gatherings that either got canceled or were much smaller because somebody had COVID. So I think people are paying attention, not just to masks, but to COVID in a way that maybe they had stopped paying attention a few weeks earlier. And that's what we need to have happening in our city.
Did you feel pressure to drop the mask mandate because you were out there all alone, and even because the federal judge pulled it off in terms of the transportation sector? Did you feel pressure?
I mean, there's lots of pressure in lots of different directions in this job. What I'm trying to do is really follow the data. And I think that's what we've done here. I've said, and I said when we announced the mask mandate, that if we didn't see hospitalizations rise in tandem with a rise in cases, that we would need to change and rethink our metrics. And that's what we're doing here. Hospitalizations peaked at 82 on Sunday, on Monday down to 77, on Tuesday down to 74, and yesterday down to 65. That's clearly not a rise in hospitalizations. And I think it just doesn't justify keeping a mandate in place when we don't need one.
Thanks, Jeff. Again, if we have time for a second round, we'll come back to you. Next up, we have Jason Laughlin of the Inquirer. Jason, you should be able to unmute.
Can you hear me?
Yes.
Okay, great. Thanks. Thanks, Commissioner. Commissioner, when you announced this a few weeks ago, you had said that you were doing a mandate because recommendations didn't work. Now you're saying they do work. Can you kind of talk through did your perspective change? Like, kind of how did you reach this conclusion that a mandate wasn't needed anymore?
So in each of the previous waves of COVID that we've seen cases rise, and that's been followed by a rise in hospitalizations. If you look at what's happening in the states and the counties around us, that is what we're seeing, right? New York State has a pretty marked increase in hospitalizations that's followed their increase in cases. And that's happening in other counties in Pennsylvania. If you look at what's happened in Philadelphia, our cases were rising steeply, right? We were, averaging around 50, 60 a day. That went up over a very short course of time into the 200s. And then it flattened. Actually, this morning, we only reported 190 cases, even though we did more than 4,500 tests. So something different is happening in Philadelphia. And then we're watching those hospitalizations. Between the 11th and the 18th, or in the 17th, they went up from 46 to 82. Again, that's a big increase than, coming down day by day to 65. So I think what we're seeing is Philadelphians, we're there, and people have paid attention, and we're seeing that in the data. So it is something different than what we've seen in previous waves, and that's what we were hoping to see.
Commissioner, could you take us a little behind the scenes at all? I mean, through no fault of the health department, as the Philly was stepping up precautions, as Jeff mentioned, kind of the rest of the country was going in the opposite direction. You had that Florida decision, and then immediately thereafter, as you're saying, people should mask indoors, SEPTA saying we don't require this in our trains anymore. Can you talk about some of the conversations with the mayor, with the administration, the back and forth of that led to this conclusion?
Yeah, I think people attribute a lot more complex motivations than necessarily are there. Our mayor has been very solidly listening to me, listening to the data. So that's kind of what we've been talking about. I think for the CDC, for federal agencies and so on, they have a much more complicated task. It is a lot to be responsible for health in Philadelphia, but really what we're thinking about is Philadelphia. And there's been, forgive me, kind of a lot of nonsense, and I don't know what else to call it, outside of Philadelphia in terms of the politicization of masks. Here, yes, they're annoying. There are lots of people who don't want to use them, but I don't think that's been as much of a factor here in Philadelphia. So behind the scenes, we're really saying what we're saying to you, which is, let's look at the data. When cases go up, that's concerning because we could see an increase in hospitalizations. If we don't see that, or if we see this dissociation happening, that's something different. That's something we need to react to. But, I have been very grateful to have a mayor who is listening to public health, is listening to the data and paying attention to that, and really prioritizing keeping people alive and healthy.
And real quick, if I could ask one more question. This is sort of similar to what Jeff brought up, but let's say another variant comes along that is very serious. Do you have any concerns that this particular mandate ending so quickly that it will make future mandates be taken less seriously, or make the public feel like there's not a lot of solid backing to any future mandates that may end up coming along?
I actually think the opposite. I very much take seriously my obligations to say things that are true to Philadelphia and to keep my promises. And I had said when I announced this, that if we didn't see hospitalizations rising, that we needed to rethink this and that we shouldn't have a mandate in that case. So that's what we're doing today. And, it is a very short span of time because that's the time we needed to see what was going to happen next. We didn't want to miss the chance to interrupt a serious wave. But with hospitalizations coming down, we feel comfortable saying, this is not a free-for-all, take off your masks. This is we're going to strongly recommend this rather than require it, because that is going to work in Philadelphia right now. But I think by keeping those promises, if I do come back to Philadelphia and have to say, this one looks bad, we really have to do something different, I feel like then people are more willing to trust that we're only going to do what we have to do and not be more restrictive than we have to.
Thanks, Jason. Up next, we have Lauren Make of NBC 10.
Hey, guys. Hey, good morning. Dr. Bettigole, I'm going to stay on that same topic to begin with, in terms of what happens if there is another wave, and what happens if you were to sort of reverse course again. Given the confusion that this caused, given that there were places like Sixers games, for example, where we didn't see people following the rules, are you concerned that people won't listen to you next time?
I would be more concerned if I hadn't seen what I'm seeing in the data, which is that cases remarkably quickly lowered in Philadelphia, flattened out, and hospitalizations went down. And that to me says people are listening when we tell them to listen. So, part of our ability to get people to listen when they need to is to tell people when things are getting better, as well, and not to be more restrictive than we have to. I mean, the fact that people don't perfectly follow rules at sports games in Philadelphia, I feel like, we talk about it a lot, but it's not really a surprise to any of us. We want people to do the best job possible in those settings. And I also want to make sure that people who do something, how should I put this? People who do something that maybe isn't ideal in terms of COVID prevention, then need to take in that they did that, right? And that's not then a great time to go visit somebody vulnerable if you just did something that maybe was an exposure. And that's where I think we see people in Philly really starting to take responsibility. I think that's what happened. And that's what needs to start happening, right? If a 22-year-old goes to a big party when there are relatively more cases, is that great? No, that's not great. In the same way that going to a Sixers game and taking your mask off, probably not a great choice right now. If you do that, you did that. So now don't go to a nursing home 3 days later. There are things we can do within imperfect human behavior to protect each other. And that's, I think, where we're going. And testing it isn't talked about enough, but it is a really important piece of this. We can test if we know that we've exposed ourselves. We can test before we go to a gathering or before we go visit somebody who is elderly or at risk. That's another way that we can help protect each other. It's not just about masks, although masks remain very important.
So if you're no longer using these metrics that were introduced just for the city, what are you going to be using?
So we are going to be letting people know what the situation is. So if we're seeing an increase in cases, we'll be letting people know. I think that 50% increase over 10 days metric as an early warning that something is going on that we want to pay attention to. I think that's still useful, not for a mandate, but to tell people what's happening. And, if there is a severe new variant, we'll absolutely want to tell people, and we'll talk with experts. If we're seeing a giant wave of cases approaching Philadelphia, we're going to be having conversations with all kinds of stakeholders to talk about what is best, what is needed to keep Philadelphia safe. I think we're all hoping that doesn't happen, and that increasingly we see variants that are milder and cause fewer hospitalizations and so on. But we've learned never to say never with this virus.
So do you think you'll go back to basing things on CDC standards, or you're still going to have a different standard for Philadelphia?
So what we're doing for Philadelphia right now is to say we are strongly recommending masks. We're not using a leveled approach at this point, other than to, have a strong mask recommendation when we see. I think we'll use the same criteria for when we want a strong mask recommendation in place that we would have used for mask precautions. Other than that, it's going to depend what we see coming. So we aren't creating a separate set of numbers or a different set of numbers at this point. We'll see what happens next in terms of, what the CDC decides to do with their own guidance. I think one of the questions that's come up there is increasingly, as people are home testing, those metrics that they designed in February with the, fewer than 200 or more than 200 cases per 100,000, it becomes a little bit less reliable. So, I think there's a lot of flux that's going to happen in terms of how people interpret data over the next few months. But the important thing for us in Philly is being able to look at our local data, see if cases are increasing, make sure that people know that if this is a riskier time or a less risky time.
Thanks, Lauren. Up next, we have Betty Chin of CBS News. Betty, go ahead.
Sorry about that. Can you hear me?
Yes.
Good morning. I just want to get clarification, just double checking this. Will the city reserve the right to do this again, meaning institute the mask mandate, no matter how long you think it might last? And also, what do you think was accomplished these past 3 days?
So I'm going to answer the second part first. I think not just these past 3 days, but since we announced this on the 11th, I think, and with thanks to the massive amount of press that this has gotten, Philadelphians know about this. They know it's a higher risk time, and it appears that they've taken action to lower their risk. And I think that's why we're seeing cases here and hospitalizations go in a different direction than they're going in the surrounding states and the surrounding counties. So I do think that people are paying attention in a way that's really important for decreasing risk. In terms of would we ever mandate again, I think if we were seeing a similar kind of wave to what we're seeing, we don't feel like we need a mandate. And we're saying we're not going to use these response levels that we previously created because we don't need to at this point. Does that mean we would ever have a mask mandate? I think it depends what happens. If there's some very severe new wave hitting Philadelphia, I don't want to ever say that, we wouldn't do anything, but, we're not anticipating that given the current situation.
Betty, do you have anything else?
No, I'm set. Thank you very much.
Thanks. Up next, we have Jamie Bessarel from Telemundo. Jamie, if you want answers in Spanish, please let us know and Zelly can translate.
Yes, please. Actually, I want the answer in Spanish, please. And if you can translate the question also in Spanish. So the question is, if a mandate that lasted 4 days and generated confusion, was it worth it? And how did it help the city in terms of hospitalization and the infection rate going down?
Zelly, do you want to translate that?
Sí, el mandato. I'm sorry. Hágame la pregunta otra vez, por favor.
Claro que sí. Si imponer un mandato de mascarillas para solo 4 días generó mucha confusión, ¿valió la pena? ¿Y cómo ayudó a la ciudad en términos de hospitalizaciones y prevención de infecciones? ¿Y por qué solo duró 4 días?
So, sí, para repetirte,
Yeah,
el
I think-
esfuerzo de el mandato de solamente 4 días ayudó a la ciudad. ¿Y cuál fue la otra parte?
Well, I think since it's been asked,
Si realmente valió la pena el que
Was it
solamente haya
worth
durado
it?
4 días.
Okay.
Exacto, sí. Was it-
Okay, so Dr. Bettigole, was the enforcement of the mandate to wear masks for just 4 days that helped the city at all? And what was the motivation behind it?
right, so, I think I would disagree that it's been confusing. I think that most Philadelphians have understood that there was a mask mandate and why. And I think that's what we're seeing in the data. If people hadn't understood that, I don't think we would see Philadelphia data moving in the direction that it's moving, given that that's different from the surrounding areas. I think that what we're seeing, though, is not the impact of the 3 or 4 days of enforcement. I think that we're seeing also the week before that in which that was announced. We wouldn't see hospitalizations going down already as soon as Monday and Tuesday based on enforcement that started on Monday. But we announced it on the 11th. We had actually signaled on the 4th that we thought we might be going toward this. So I think that Philadelphians have had some time to kind of absorb this and react to it. And it does seem like that information, that this was a warning, that things are worse and different and that we need to pay attention and be more careful, is something Philadelphians have listened to and, have responded by taking care of each other. And I think that's been the thing that's been really encouraging to me to see, is people thinking about this in terms of, I want to get together with people for the holiday, I'm going to test first. Or people going to, arranging church services, arranging for the choir and the service leaders to be tested so that they wouldn't be spreading COVID to the congregation, asking congregations to mask when possible. So I think there's been a lot that individuals in the city have done in response to this announcement. That is the reason we're seeing the data improve rather than 3 days of enforcement. And again, that's why we feel like a mandate isn't necessary at this point in Philadelphia.
Okay, so what I would say is, Dr. Bettigole, that was a lot of information to translate in one
I'm so
shot.
sorry.
So I'm going to ask the person that asked the question to contact me electronically, and then we can communicate back and forth and give them an adequate response and more information than I would be able to translate after your response.
I'm so sorry.
No, that's okay. You're perfect. I'm just a little new to this.
Jamie, is that all right with you?
I have one more question, please. That is fine. Yes. And if you can just provide me, yes, with that information, I'll be more than glad to get in touch with you. And I have just one more question, please.
Sure.
The credibility of the city and the health department, how does this affect the credibility of both if, if it lasted so short, it was so short, and for the future mandates as well?
Well, look, so we made an announcement and Philadelphia responded, and we are now seeing cases level off and hospitalizations go down. That, I think, speaks to our credibility, and it speaks to Philadelphians. That's what we need to see, and that's what matters. So, I think this has been effective, but I think it's also shown us that Philadelphians can do this without a mandate. So, overall, I am really proud to live in a city that is taking care of itself, taking care of its members, and where people are caring for each other. I think there's way too little of that nationally right now.
Hey, Jamie, same thing. We'll follow up with you after this for a Spanish recording. Thanks.
Okay, sounds good. Thank you.
Up next, we have Mike Rubenkamp from the Associated Press. Mike, you should be able to unmute.
Hi, Dr. Bettigole. So you're basing this decision on just a few days of data. Is that scientifically valid? I mean, it's common for daily numbers to fluctuate. Is that enough data to justify a decision like this?
So when we started to see the cases flatten, we started to see hospitalizations initially come down a little bit, we thought that was probably just wiggle in the data. But, it's been pretty consistent in terms of those hospitalization numbers. When we make decisions like this, I don't make them single-handedly. What I do is I talk with our internal team, and I also talk with public health experts, including each of the members of the Board of Health. And we have a wonderful expert team on the Board of Health. This is a joint decision. But, I think the pattern we're seeing in both cases and hospitalizations, we're seeing positivity also come down. It's pretty consistent. So with all of that together, this feels like the right thing. And, I have said from the beginning that we didn't want to keep this mandate if it wasn't necessary. With this steady decrease in hospitalizations, with the cases leveling off, we are not seeing that sustained rise that we were worried about seeing.
One other question. On the 11th, you said it was important to impose a mask mandate to head off a potential wave. If that was good public policy then, why wouldn't it be good public policy going forward?
So it looks like what happened was that announcement itself was enough to head off that wave. If you look at what's happening in Philly compared to the surrounding areas, the other northeastern states, it looks like that did work. We, consistently want to be the least restrictive necessary. And if that level of warning is enough to head off a wave, then we don't need a mandate. So, I think this has been good information for us. We always intended to have this be as short as possible. I think the good news on cases and hospitalizations means that we're ready to stop it at this point.
Thank you.
Mike, you good? Okay. Next up, we have Sophia Schmidt from WHYY. Sophia, you should be able to unmute.
Hey, thank you. So Dr. Bettigole, you're talking about the fact that hospitalizations did not continue to increase as being one of the key kind of markers that we didn't need the mandate. I'm wondering so the thing that triggered the mandate in the first place was cases, not hospitalizations. Are you considering putting in place some kind of other triggering system that would actually emphasize hospitalizations more?
Not at this point. I think what we have is the ability to continue to watch numbers, to notify people if we start to see a rise in cases. And, what happened in Philly, which has happened in other places, is we did see a rise in cases that was followed by an initial rise in hospitalizations. But, the timing is such that it looks like once people started paying attention to that, that was able to kind of stem that rise in cases. And then you see hospitalizations after that start to drop down. So, I think this is a very different situation. We aren't looking to put in different numbers or different metrics at this point. If there is some very severe new wave, we will all be putting our heads together. We'll be talking to external experts, figuring out if something else is necessary. But for now, what we're doing is keeping people informed.
Got it. Thank you. And I know you kind of asked or answered this question from others, but you're saying that what worked was this warning, basically the looming mandate that was triggered by these metrics. So why not have, I guess, warnings in the future that are triggered by metrics? Like if it worked, why are you dropping it?
So we will warn people if cases are going up. I don't mean that we won't, but the system that we had built had various mandates built into the different levels. And so that's something that no longer feels like it is necessary. So certainly letting people know if we see a sharp increase in cases, absolutely we would do that. And similarly, if cases drop way down, and that's a time that people can relax and not have to wear masks and not have to, in the common sense, keep safe way, not in the mandate way, we'll also let people know that.
Okay, thank you.
Thanks, Sophia. Next up, we have Carolina Rodriguez from Univision. Carolina, you should be able to unmute.
Hello, good morning, everyone. Thank you for taking my question. Dr. Bettigole, I just have a question comment. Just yesterday at 1:30 p.m., Mayor Kenney was defending the mask mandate in a forum with the colleagues from the Washington Post, and he mentioned that he strongly recommended the mandate and he was very proud that the city took action. But is it just bad timing for the city right now?
Is it bad timing?
For the mayor yesterday been defending the mask mandate, and for today, the health department being just like, we're not going to have a mandate anymore?
Well, I think that the announcement of the mandate and the fact that we have been science-based is something that we're very proud of. For how to put this was a Board of Health vote last night, and so it needed full discussion with the Board of Health before any changes could be made.
Okay. Also, is this the city's answer to the lawsuit that was filed last week?
No, this is a response to the data. I have consistently said that if we didn't see a rise in hospitalizations after the rise in cases, that we would need to rethink the mandate. And so, when I first saw the numbers starting to come down on Monday and Tuesday, again, I thought it might be wiggle. But, when we saw yesterday, the numbers continue to come down and to go down to 65 from 82, it started seeming like we really were doing something that was no longer necessary. And I've always promised not to be more restrictive than necessary.
Thank you very much.
Caroline, are you good?
Yes, I'm good. Thank you. Have a good weekend.
Thank you. Next up, we're going to go to Jacqueline Lee of 6ABC. Jacqueline, you should be able to unmute.
Thank you. Hi, Dr. Bettigole. So average cases are 242 per day, and cases have increased more than 50% in the last 10 days. So based off of that data, wouldn't that put the city in level 3 based off of the city's own metrics?
So if we were still using the response levels, it would. And I think that's a good example of why we've decided not to, and actually this morning, the average is now down to 224. But, with cases no longer going up, with hospitalizations going down, we wouldn't want to invoke additional mandates. And so, again, we've said if we start to see a dissociation of hospitalizations from cases, if we start to see hospitalizations no longer going up after an increase in cases, then it's time to rethink. And that's what we're announcing today.
Okay, so you're announcing the city is no longer following those metrics.
Correct.
But you also impose the mask mandate based off of those metrics. So do you see how this could look like it's undermining its own authority, the health department?
So what we had said was we're using the metrics as an early warning symbol or an early warning sign. So when we started to see that increase in cases, we put the mask mandate into place to make sure that we could head off an increase in hospitalizations if one was going to happen. And we said at the time that if we didn't then see an increase in hospitalizations, that we needed to rethink. And that's exactly what we're doing. So it really is consistent. We're doing what we promised to do. We announced these metrics back in mid-February based on the existing data that we had then. And we've said that we would reevaluate them based on data that we see with future waves. So here we're seeing hospitalizations coming down, cases flatten or decrease. It's time to rethink that.
Okay, and then you guys have talked a lot about hospitalizations. During its peak, the city had 82 hospitalizations, but it's a population of more than 1.5 million people. So the argument would be, well, hospitalizations were already low. So why would you impose this mask mandate?
So what we were basing this on initially was the rate of increase in cases and the case count. That initial rate of increase in hospitalizations was somewhat concerning. Had that continued at that rate of increase, we could easily have been very quickly in the hundreds. I will say we're seeing substantial percent increases in hospitalizations in, for example, New York State and in other places in the Northeast. So it's not a consideration that we would just want to ignore. But here in Philadelphia, with people taking increased precautions, it looks like it's not necessary.
Thanks, Jacqueline. Next, we're going to go to Campbell Robinson of the New York Times. Campbell, you should be able to unmute.
Hi, thanks again for doing this. I just wanted to go back to the metric system. So the response system. So the idea of the response system was so that there would be some transparency among folks who would know when levels hit a certain number, they would know what would happen. Is the idea that a system like that in general is going to go away, or that it will be redesigned and then re-implemented on with different metrics, or is just the whole sort of automatic triggering response system going to be done away with?
So we're no longer going to be using an automatic triggering system. And there's a couple of reasons. One is that we're seeing this disconnect now in Philly between hospitalizations and cases. I'll also say we designed that system back in February with a lot of stakeholder input from the business community, with the idea that if we did have to trigger something, everybody was already on board. That clearly has not worked. So, I think the idea of then building a different system based on updated metrics doesn't necessarily make sense. I think what we would do is just, in general, keep people updated about the level of risk. And then, if there is some awful new variant, obviously, then we all have to put our heads together and figure out what is necessary. But we're not planning on coming up with a different metric system at this point.
Does that suggest, because the divergence between the cities and the CDCs was a focus on hospitalizations as the driver of the metrics, does that suggest that sort of the city will, this might not be the right word, but sort of deferring to the CDC system going forward because it was more hospitalization focused?
I mean, I still think that letting people know that early warning sign of an increase in cases is very useful. I just don't think we need to do that with a mandate at this point. But the paying attention to a 50% increase in cases over 10 days, even if cases are relatively low, I feel like that is in part what bought us that decrease in hospitalizations that we're seeing now. So I think it's useful to be able to tell people in a sort of forecasting way, this is what we're seeing, but without the mandate, essentially.
Campbell, you good?
Yeah, thank you.
Thanks. Since we did start late, we do have a couple extra minutes for a second round of questions. Next, we'll go to Jason Laughlin. Jason,
Hi.
you should be able to mute.
Yep, thanks for coming back to me. Commissioner, a couple quick things. As you mentioned, cases are still going up and hospitalizations are going up in other parts of the Northeast. What is there a concern that with this mandate being lifted, Philadelphia will just very quickly follow suit with its neighbors?
I part of my job is just to worry about everything. But I think in terms of what we've seen, Philadelphians didn't wait for enforcement to be careful. And I think that's very encouraging. And we're going to have to continue to be careful. I mean, this is clearly, there's an elevated level of risk all around us. This is not a time that we should say woohoo and throw our masks off and go to parties. But it is a time that I think people can take reasonable precautions. And that includes not just masking, but again, testing if you have been exposed, testing if you're having any symptoms, testing before you go to see somebody vulnerable. All of that will help us. One of the things that is very clear in the data from all around the US is that people being hospitalized, the increase in hospitalizations is really driven by people 75 and up. And that means all of us need to be careful if we are visiting with or living with somebody who is elderly. consistently they have the highest risk from COVID, and we want to protect each other.
And very quickly, how would the city respond if the direction in hospitalizations changes course? If in the next few days or the next week you see it going back up again?
We will be blaring information from the rooftops. I mean, not literally, but I think people responded really well to very loud and clear information. And I think that's what we would work on doing.
Thank you.
Thanks, Jason. Next up, we have Rudy Chinchilla from NBC 10. Go ahead, Rudy.
Thank you. So Dr. Bettigole, I think you might have sort of answered the question already, but so the getting rid of the metrics that you guys imposed is the practical effect of that just to give you guys, you and the rest of the board, more leeway in terms of determining when the city will impose mandates if it needs to do so without having to hold yourselves to this self-imposed standard that you guys had implemented, as you said, in February? Is that the practical effect?
I think the practical effect is actually the opposite, which is not to be tied to having to impose mandates when we don't think they're necessary. And I think that Lauren's question earlier about, I think it was Lauren, about the move to level 3 is a great example of that. We don't feel like we need to move to a vaccine mandate for dining establishments right now, but the metrics could push us that way. That doesn't feel necessary right now, given the direction of our numbers. So, what we're trying to do is to move away from kind of these triggers and, more toward we want to make sure people have really solid information and understand what their risk is, and that they have all the resources they need to protect themselves. And, a piece of that too, we have people out in neighborhoods all across the city giving out home test kits and trying to make sure people have the information and the resources they have to protect themselves.
Okay, and then the other question, it goes back to, because you've referenced it a couple of times, the announcement of the mandate being made April 11th. Was that an intentional decision that you guys made to see if people would take it upon themselves to use masks, or is that just sort of like a happy coincidence that you guys announced it on the 11th, started enforcement on the 18th, but people before the 18th started, it seems, using masks, and therefore cases started dropping?
It wasn't, we weren't doing an experiment. We were really announcing to give people a little bit of time to get themselves organized and to, put signs up and to get information out, rather than trying to say, it's effective today, we will be enforcing today, which feels a little unfair to businesses. So, it wasn't an intentional exercise, and will people do it without the mandate? But I think effectively that's what we've shown.
Okay, we have time for one last question. Lauren, go ahead and ask a question.
Hey, Dr. Bettigole, I wanted to follow up with something I heard you mention. You talked about being science-based, but you've also talked about how in Philadelphia there are other considerations given the population in Philadelphia, access to healthcare, and that maybe things should be looked at here differently than they would be in an affluent suburb. So, are you still considering the decisions that you're made purely based on science and data, or are you considering a bunch of other factors and saying it's a combination of things?
Well, it is about science and data, and the data on.
But is it purely about science and data?
It is. The thing to know about Philly, though, is the numbers on who is more at risk and by what census tract and what population and so on. That's also data. So it is all science and data. It's just that we think that we can't ignore the data on populations at higher risk in our city. And the decisions to be more conservative in Philadelphia about risk do relate to our history of being the largest poor city, or the poorest large city, I always say that backwards, in America, and having high rates of underlying chronic disease in populations who are at high risk, people who can't work remotely and so on. But I think it really is a testament to Philadelphians and how much we actually are willing to take care of each other, that we are seeing this turnaround here, and that we've seen lower rates in Philly, even though our surrounding counties are wealthier and higher vaccinated and less diverse. And yet, Philly actually does well. And, you know, we'd love to take credit for that in the health department, but I think that is actually the actions of individual Philadelphians who are paying attention to each other and taking care of each other.
Okay, seeing as we are well past 11, we're going to end today's availability. Thank you for everybody for joining us today. Goodbye.